treatments options are available in doctor's office. The average time frame required for the successful treatment of cervical and anal and genital warts is approximately 8 months. Eliminating the visible aspect of warts will not always eliminate the HPV virus completely, and warts can reappear. The treatments for warts are chemical treatment methods, but they can be very painful, embarrassing, and may cause scarring. And there's new products. Imoclid mode cream called Aldera is now available, and some success at stimulating the immune system to fight the virus when they cause external genital and anal warts.
Okay, so what are the treatments of precancerous lesions?
Precancerous lesions rarely cause any noticeable symptoms. They are usually detected through a pap test or colposcopy. It does take many years, as much as 10 years, for the precancerous cells to develop into cancer. So having a regular pap test will ensure that any abnormal cells are detected. The most common reason for women developing cervical cancer is because she did not have a pap test. Precancerous lesions can usually be treated successfully. Options at staging can include loop electrosurgical excision procedure, LEEP, which involves the removal of tissue using a wire loop. Other treatments include laser therapy and cryotherapy.
So what are the treatments of HPV-related cancer?
Once you have been diagnosed with cervical cancer, it means that there is invasive cancer in the deeper layers of the cervix, and it has spread to the uterus. If the cancer is limited to the cervix, it can be treated with the removal of the uterus, called a hysterectomy. If the cancer involves the anus or the genital area, the cancer can be treated by surgery or radiation.
Great. So, can young men get HPV too?
Yes.
And how does it affect them?
The most common sign for HPV in young men is genital warts. In fact, genital warts seem to affect as many young men as women. Some rare cancers in young men are also linked to HPV. Up to 90% of anal cancers, most common among men who have sex with men. 40% to 50% of cancer of the penis, and 10% to 20% of cancer of the mouth, head, and neck are caused by HPV infections. These cancers do not usually develop until later in life.
So are genital warts a sign of HPV?
Genital warts are often the only sign that someone has an HPV infection. In fact, it is the most common sign of HPV in young men. There may be one or many warts that you can see and feel on the penis, scrotum, anus, or thighs. They may look like a small cauliflower. Some warts are not visible because they grow inside the anus. Although the warts are unsightly, most of them are painless. Sometimes they cause burning and itching. Some studies have shown that 2 out of 3 people who have sexual contact with a person who has genital warts will become infected.
So can genital warts be treated?
Yes, genital warts can be treated. In some cases, warts are treated at home with medicine, and in others at clinics with medicine, freezing, or by surgery. But no treatment can destroy the virus. When the warts are gone, it doesn't mean that the HPV is gone. In 1 out of 4 cases, the warts will return within 3 months.
So tell me more about HPV for men.
Currently, there are no real tests for young men for HPV. The only guaranteed way to prevent any type of HPV is to abstain from sex. This means no vaginal or anal intercourse, no skin-to-skin contact in the genital area, no sharing of sex toys, and no oral sex.
Is there a vaccine for men?
In 2010, Health Canada approved an HPV for young men ages 9 to 26.
What can people do to reduce the risk of getting HPV?
There are a number of ways to reduce the risk of getting HPV. Practice abstinence, no below-the-belt sexual activity, have safe sex with only one partner, always use a condom, but condoms do not always fully protect against HPV. And quit smoking. Smoking makes the body less able to fight off HPV infection and is a factor in the development of various cancers.
So do women need to worry about HPV if their partner has been HPV vaccinated?
If your girlfriend has been vaccinated, she is more likely to be free of HPV types prevented by the vaccine types 6, 11, 16, and 18, the most common genital warts and cancers of the cervix. But this does not mean you are fully protected from HPV infections. She can carry other types of HPV virus. If your girlfriend was sexually active before she was vaccinated, she may have one of the types preventable by the vaccine. Vaccines can only prevent, not cure the HPV infection.
So could you give me a quick overview of exactly what HPV is?
Okay. HPV stands for the human papillomas virus. The bad news is there are many types of HPV virus, and because HPV is very common, chances are you will contact it in some form of HPV in your lifetime. The good news is most HPV viruses will clear up in its own time. There are no signs and symptoms, and the virus is usually harmless. But what you need to know is all of the HPV virus can persist. Some types can consider high risk and low risk, and some can cause genital warts and anal warts. In women, warts can appear in the vulva, urethra, cervix, vagina, anus, or thighs. In men, warts can appear on the penis, scrotum, anus, or thighs. The HPV virus is transmitted through skin-to-skin contact during sexual encounters, even if there is no penetration. It is a bit like transmitting bacteria through your own hands. Most people who come in contact with bacteria do not get sick, and there are no signs or symptoms from this infection.
How is HPV spread?
HPV can affect anyone who has had a sexual encounter without penetration. The most common way to spread HPV is skin-to-skin contact during sexual activity with the penis, scrotum, vagina, vulva, or anus of an infected person. Kissing or touching someone's genital with the mouth can also transmit HPV. Using a condom is an excellent way to protect against HPV, but it does not protect fully. The truth is, the HPV virus is the most common and very contagious, but it usually has no problem. In most cases, you will have no symptoms, and the HPV virus will go away. But certain types of HPV